Hello and welcome to On Second Street. Today we're going to have a big discussion about healthcare. We've got a federal election on right now. We've got a healthcare system that's in crisis. We've also got the federal government tinkering around with some of the healthcare products that you may depend on. So we're going to talk about those two topics today. And joining me to talk about this is Nadeem Esmail. He is a senior fellow with the Fraser Institute focusing in on healthcare policy. Nadeem, thanks for coming on the show again to talk about healthcare. Always appreciate chatting with you on this topic. I wonder if you could just tell us, in this country, healthcare, we tend to think of it as a provincial responsibility. It's the provinces that run the health regions, the hospitals, and so forth. But yet Ottawa's involved. And I wonder if you could just maybe walk us through maybe what some of the changes are that you think should be happening at the federal level, things that voters may want to consider as the election continues.
Well, thanks for having me on the show. Ottawa's role in healthcare is really a financial role, but in that financial role, they set a number of rules and regulations that the provinces must follow under the Canada Health Act. And so, in order for provinces to have access to the full federal cash transfer, which is about 55 odd billion dollars this year, quite a lot of money, they must follow those rules and regulations. And importantly, not just the written rules and regulations, but the federal interpretations of them. And what that has done is effectively frozen the Canadian healthcare system in terms of reform. It's stuck us in this healthcare system that is simply unable or unwilling to meet the needs of Canadians, either the people who fund the care or the patients who are trying to receive it but stuck in these long queues. It seems to me the answer, as we look internationally, as we look at how the system is structured, is for Ottawa to learn from its own lessons of the mid 1990s. In the 1990s, Ottawa had this same setup for welfare, and they got out of the game of setting policy at the provincial level. They let the provinces innovate, they let the provinces tailor to their specific populations. The result of the federal government stepping back was a reduction in dependency and improved programs for Canadians. So less money, better services. And I think that same lesson needs to be applied in healthcare. We need Ottawa to get out of the policy game and free the provinces to decide if they want to follow successful models in Europe, or if they want to embrace this failing system for whatever reason, and at least be accountable for that decision.
So does that mean in your mind that Ottawa would just cut a check and get rid of, say, the Canada Health Act, get rid of all the other stipulations and regulations or whatever, and just say, here, provinces, here's money, you guys take care of it. Is that kind of what you're talking about, or something a little bit more nuanced?
I think a little more nuanced. I think Ottawa needs to step back both from setting policy, but also step back from the financial responsibility for healthcare. Allow the provinces to really, truly be responsible and accountable to their populations to raise the funds. So, reducing the federal cash transfer, allowing the provinces tax room then to take up and fund the healthcare system themselves, or alternately over
Mhm.
time, simply holding that transfer constant and letting it fade down over time as the economy and the population expands. Either way, reducing both the federal cash role in healthcare, which is important to clean up the federal finances. We know we have a government that is now deeply indebted, that has run consistent deficits for
Mhm.
quite a period of time, and they need to solve that problem. But also to give the provinces not only the responsibility, but the financial responsibility for the healthcare system, clarifying lines of accountability for the public, and really imposing on provinces the responsibility, financial and constitutional or jurisdictional, for healthcare.
So we've got a little over a minute left here, Nadeem, but just when you think about the election, I know you're following it. Are you seeing any of the major political parties talking about any types of health reforms that you think would be helpful when it comes to healthcare?
I think if we look at the two major parties, we're seeing really nothing on the healthcare file. They're both fully committed to the health transfer program that is set up and in place. No one's talking about reforming the Canada Health Act, which is now over 40 years old and is well and truly outdated, considering what we know about health reform and health policy now today, and committing to the big transfers, even though they're still committing to trying to balance the book. So I just don't see a lot of action from either major party. Perhaps unsurprising,
Mhm.
healthcare is the third rail of politics. You don't want to get into that fight when you have other fights to have. But I think for Canadians, it's a bleak future when it comes to healthcare, at least at the federal level.
All right. Listen, Nadeem, when we come back, I want to unpack this more sort of in terms of what the recommendations that you would put forward to political parties, recognizing that I think maybe the big one they might not eagerly accept, and that is just getting out of healthcare altogether. I want to understand if there's maybe some other things that they could do that maybe they might consider to be a bit more politically doable. When we come back, we'll continue to talk about health reform in light of the current federal election. We'll be back in just a moment.